Good morning, and thank you for joining this session today. My name is Mazzonetto. I am project manager at EXA, the European Citizen Science Association, and I'm really happy to be the chairperson for this session today. The topic of the session is citizen science and health. As you probably have seen in the program, the session will last 1 hour, and we will have 4 speakers with us. So each speaker will have a slot of 15 minutes, and we will follow the order as it appears in the program of the session that you can find on the conference website. We will have time for questions at the end of each speaker's presentation. So please, if you have any questions for the speakers, do not wait until the end of the sessions, but please do post them in the chat right away, and I will make sure that the speakers get hopefully all your questions. I'm going to go straight into the first presentation as we have a very short time available. So our first speaker for today is Borda, who is an associate professor in the Centre for the Digital Transformation of Health at the University of Melbourne in Australia. Thank you very much, Anne, for being with us today. So I switch the microphone to you.
Thank you. Thank you very much for the introduction, Marzia. I'm going to share my screen now and start the presentation. One moment, and we'll be right with you. But I'd like to acknowledge while I'm doing this, acknowledge my colleagues, Andreea Molnar from Swinburne University in Australia, and Professor Kostkova from UCL, who co-wrote this presentation and also the study. So to begin with, we see a convergence of very high use of mobile game apps globally, and these are $100 billion investments in the marketplace. And the rise of Pokemon Go and Candy Crush, for instance, are typical games within this marketplace. And we see a global...
And I'm really, really sorry to interrupt you, but we are not managing to see your slide. Can you try to share your screen again?
Oh, sorry about this.
No worries.
Yes.
Yes, now it's showing.
It's showing, and...
Yes. It is not in presentation mode, but hopefully it will be okay.
Yes, I will do this again. So can you see this now?
No, I think when you shift to presentation mode, the image disappears. So maybe can you try by sharing the entire screen and not just the application window? So when you do share, can you share the entire desktop?
Let me just see. I'll try again. Sorry about this.
No worries.
I'll try entire screen.
Yes, please.
And now I will go to my slideshow.
Perfect. Let's see if it works.
Is that good? Does everyone see that?
Yes, that's fantastic. Terrific. Thank you very much, Anne.
Apologies. So just to continue then, we are witnessing a big uptake of mobile game apps in particular. And some of your favorites might be on this image. But also more seriously, gaming is very much associated with education, and particularly where we're looking at games and task completion, or very high rates of retention are proven to be supported by gaming. And also, importantly, in a health context, increasing self-confidence and also improving conceptual knowledge. So what is a serious game? Well, if we take the word serious, it's about a serious purpose where the game is helping to impart knowledge or skills. And again, in the health context, serious games are often supporting reinforcement of positive changes in behavior. So very much associated with serious games, aspects of problem solving and goal formation, but also strategic thinking and enhanced creativity, which all lead to outcomes around support in depths of involvement and cognitive improvement. There are 2 motivational behaviors often associated with games, and this includes intrinsic motivation, extending or exercising one's capacities to explore and to learn, an extrinsic motivation driven more by external factors such as the enjoyment of competition, for instance, or a reward system. And serious games, as we find through the study, is often a mix of both, where we might, in a citizen science context, for instance, be helping to improve scientific knowledge, or in a health context, perhaps acquiring confidence in undertaking a task. So serious games in health have, not surprisingly, risen exponentially as much as the game market, and not least because of the accessibility of gaming platforms, but also the increase in what we call mobile health, so apps on mobile phones, low cost, so lower barriers to entry, and also increasing digital literacy by participants. So what's unusual about serious games in health, perhaps, is the way that we are linking the relationships between different types of wellness or classifications of health to players who might be professionals or non-professionals, for instance, in the health workforce, or a medical professional, and then classified by a patient or a non-patient, for instance. So the purposes of serious games can be summarized as follows: supporting medical education, for instance, so through simulation to help reduce errors in diagnostics; patient education, supporting health literacy or building that confidence in self-directed care; or more often in health promotion, for instance, using games to approach children's learning about microbes and hygiene; and also healthy lifestyles, which are using aspects of positive reinforcement through, let's say, exercise. So medical education is an example of a VR-based game around advanced life support training platforms. This is aimed for medical students, for instance. My colleagues have been involved in game development for Nigerian health professionals, reinforcing decision support around microbial stewardship and supporting decision support. So you can see a decision support tree, which was used for the gaming application in the image. And patient education, this set of interfaces is related to young children using mobile games to help them address anxiety. So patient education can go across monitoring, detection, treatment, and education for self-directed care, for instance. Health promotion, in this example, again, my colleagues have been involved in this game development of children learning about hygiene and the role of both bad and good microbes, and very timely with the COVID situation as well. So healthy lifestyle has been proven to be very popular among serious games, and particularly games like Pokemon Go have been linked directly to more healthy lifestyles for those playing the game, in terms of, amounts of exercise that they might do outdoors. But games are also very much linked to indoor activities as well. So this study linked to this presentation was firstly a state-of-the-art review, and then looking at participatory forms of public health and serious games environment, and also looking particularly at serious games in public health citizen science. So in citizen science, there's broad definitions of what that might be, particularly in a health context, because we see crowdsourcing behind serious games, citizen science tasks, as well as participatory action research and the role of the individual. And so we have different contexts of many to a game, a relationship of many to a task. The notion of we, where there might be a community of interest, and N of one, where it's an individual's interests. So gamification of tasks can include a number of areas, such as identification of due data, but largely around improving accuracy and analysis. So more complex problem solving are often associated with serious games and citizen science. So you might be aware of Fold It, the protein folding game, and the link now also to a coronavirus. So players are actually working for supporting coronavirus research. Cancer Crusade, which is looking at treatment doses to cure cancer, and multiple game platforms are supported by Cancer Crusade. iWire, which is a game around neurons in the brain, reconstructing neurons, and connectomes. And here we see iWire is very much approaching an advanced gamification with introductions of heroes and dare I say cat videos. So very much an intergenerational game. And perhaps one of the more substantial game platforms is Project Discovery, now introducing coronavirus data, what are called flow cytometers, so fluorescent cells, for gamers to approach. And this Project Discovery, part of the Human Protein Atlas, has 1 million subscribers and plus. So one of the elements of this study was really around how citizens get empowered through gaming, and in methodologies around participatory action research, for instance. And this is very much tied to our right to health and our ability to participate in our home health care. So whereas citizen science games are often about us using research data that's been set up by a researcher, and we're helping that research. What about health that impacts us directly? So there's a very famous phrase about nothing about me without me, and how can we meaningfully engage in serious games in this context? So Learn to Quit is an app that was developed by a group of severe mentally ill individuals with psychotherapists. There's very high nicotine addiction rates in individuals with severe mental health issues. So this game was around a co-design context. Another example is our game jams, and this one is using Game Jam to bring together facilitators and healthcare professionals, game designers, and the patients themselves, and to do a rapid prototype around a respiratory health game for young adults. And game cards were introduced so that individuals could choose which ways the game might go, and what might be included in terms of narrative and challenges, for instance, and goals that might be achieved. And finally, another game that came out a few years ago was eSmart, around another mental health, particularly high among a participatory action type research gaming, and using avatars, for instance, for young adults to express their relationship to depression and ways in which they can self-manage. So this study was very much around ways digitally enabled public health outcomes could be supported by serious games. But also future work was definitely highlighted through what we have seen, that more interdisciplinary research is required to understand motivational behaviors and the link to participation types, but also the characteristics of serious games and forms of end-user participation within a public health context. So that's my talk, and I thank you very much for listening.
Thank you very much, Anna. That was really sharp on time. Since you lost 1 minute at the beginning, maybe I can ask you one very quick question. Will you be able to answer in less than 1 minute, possibly, but
try.
then you will have more time. So someone is asking, how would you tackle the problem of health gaming apps to predetermine what a healthy body should look like, especially in contrast to diversity goals, such as body possibility and disability?
That's a very good question. And again, I think it's going to be very much around involving the people who are impacted by these issues. And again, using a co-design or co-create development approach. A very sensitive issue, and one that you will want to try and have an iterative approach to address.
That's great. Thank you, Anne. There are more questions that will be shared with you later on. Now we have to switch to the next speaker, but thank you very much for your intervention. And while the technical team change speakers, I would just like to remind to all the participants that all the recordings of the sessions will be available until the 13th on the conference website platform, and that also the speakers will be invited to upload their presentation to the conference website. So I hope most speakers will be sharing their presentation with the participants, as there were many questions on this. So welcome to our next speakers, who is Nils Heyen so Nils is a sociologist and works as senior researcher and project manager in the business unit Innovations in the Health System at the Fraunhofer Institute for Systems and Innovation Research in Germany. The title of Nils' talk is Patient Science as a New Citizen Science Approach, when fragile groups such as chronically ill people become citizen scientists. Thank you, Nils. Welcome, and now over to you.
Thank you very much. I will share my screen. Oops. Now I switch to my slides. I hope you can see my screen. Okay. Okay, since I don't see the chat anymore, I hope everything works fine. Otherwise, you just interrupt me. So thanks for the introduction. Before I start, I just want to let you know that I'm fine if you want to take pictures of the slides, but as normal, if you refer to any contents of the slides, please just mention the project or my person or this talk or whatever, so that it's quoted properly. In the next 10 minutes, I first want to introduce briefly the Patient Science Project, which is still running and has started in 2017. I will then reflect a bit on the relationship between patient science as an approach and other participatory approaches in health research. And I then will discuss implications of involving chronically ill people, and finally will present some benefits and challenges of this patient science approach. So just to give you an idea why we set up this project, our starting point that was back in 2016 was that we observed hardly any citizen science activities in medical or health-related research exist. Usually you have these crowdsourcing types, but you don't, usually people serve more as test persons and not so much as active researchers. And the basic idea we had was that we wanted to conduct a citizen science study in the health sector, but we also wanted to achieve a highest level of participation for citizens or patients. We choose rare diseases as a field of investigation because we thought we could have the highest possible impact here. And we finally came up with the disease of cystic fibrosis, which is a rare disease. But in Germany, there are still quite well-established self-help structures which we could build upon. And that's why we finally choose that disease as our case. Our project has been funded by the German Federal Ministry of Education and Research in its citizen science funding program. It started in 2017 and will end at the end of this year. And apart from the Fraunhofer Institute of Systems and Innovation Research, where I work, our project partners are the University Hospital Frankfurt, the Westphalia University of Applied Science, and the German Cystic Fibrosis Association. And just to make one point very clear at the beginning, as we applied for the funding of this project, we didn't have the research question yet. So we really went into this proposal or in this funding process that we said we have three aims. We want to have research into an essential problem in the everyday life of CF patients and their relatives, but this is not specified so far because we wanted to set up a co-creation process with the patients. And by doing this, we also wanted to identify the benefits and challenges of patient science as a possibly new citizen science approach. And we want to achieve that high level of participation of patient researchers, as we call them, in all phases of the research process. So very from the definition of the research question to the empirical investigation and to the exploitation of results. And so we started by setting up a patient science team, including 12 patient researchers that were patients and parents of CF-affected children, and also including 8 professional researchers, social scientists, and healthcare professionals. And in the co-creation workshop process, we came up to the following research topic. We wanted to systematically map and measure the typical and most important everyday problems of CA patients. That means that we decided not to dig deep in one specific problem, but first to set the scene and do the systematic mapping. And in a second step, we want to analyze these results with regard to the need for support and orientation that the patients may have. And just to give you an idea that how diverse all these everyday problems could be, I mean, they can concern the living and housekeeping, they can concern the social environment and leisure, they concern the mobility and traveling, also the occupation field. You can think of school training, university studies, and also the professional job. And they also concern the professional care and the self-treatment. So they are very diverse, and the effects of these disease, if you have it, are very are high and really concern every single day in your life. Also, I don't mention that again, in a co-creation process, we choose the methodology. So we decided to do a standardized online survey of the German CF community. That was last summer. We developed a questionnaire that was very long, but we decided to keep it in that length. So we had 271 items, which is much longer than usually in such standardized surveys. But we are very happy and lucky about the response rate. We got more than 10% of the estimated 8,000 affected persons in Germany. That was great. And I don't want to go now into the contents of the results. That might be too specific, not of interest here, I guess. But what we get as a general feedback from external experts, professionals, and patients was that we did ask the right and relevant questions, and that finally now there is, due to our study, the scientific empirical evidence for many problems in everyday life with CF. And one person said data instead of anecdotes. And we also have a high usability for activities, or the results have a high usability for activities in health politics, in patient care, and also in self-help. But if you might think that there are also other traditions of participation by laypersons in health research, and you might know lots of them. I think the approaches that come most closely to the patient science idea are the approaches of community-based participatory research or participatory health research. But if you compare them, there are some differences I just want to mention briefly. So the PHR, the participatory health research, is much more strongly aimed at the continuous transformation of specific life conditions or practices. It's in the tradition of action research, and patient science is not, we would argue. PHR is also located more in the public health sector and thus focuses on socially disadvantaged people, whereas patient science really focuses on patients that already have a specific disease, so on health disadvantaged people. PHR has a special focus on local condition, which is not the case for patient science. And patient science explicitly aims at the participation of laypersons and not so much on the participation of stakeholders or health professionals. And whereas PHR is more about the empowerment with regard to specific living conditions and problems, so they really want to change the living conditions, patient science, we would argue, is more about the empowerment with regard to knowledge production. That's why we think it's belongs to citizen science, but there are also some specifications with regard to citizen science. It is citizen science, but with a specific thematic focus that is clear, health and medicine, but also with the participation of a specific group, that is patients or people affected by a specific disease, with a far-reaching participation approach that is co-creation in all phases of research, and by making use of the specific expertise of the patient research involved, which we call the patient expertise. And for sure, there are several implications of involving chronically ill people. And first of all the patient researchers have a very high intrinsic motivation, and they automatically bring a specific expertise, as I said, the patient expertise. And on the other hand, they face the challenge to be not biased by being affected. That is a challenge the patient researchers face. Another implication is that you have a potential low physical resilience of the patient researchers that affects the project management as a whole. I will come to that in a minute. And you also have a potential mutual risk of infection among the patient researchers that affects the feasibility of face-to-face contacts. And I'm now not talking about the corona pandemic, but even before, we as a patient science team, we couldn't meet in a group face-to-face because among the patient researchers, some people shouldn't meet because of this mutual risk of infection. And these implications also bring along some challenges I want to focus now. One of the challenges is the cooperation of the professional researchers and the patient researchers. So the challenge here is to find a balanced form of involvement, which gives the patient researchers as much personal responsibility as possible, but also as much support as necessary, so that they are able to participate in the entire research process as reliably and responsibly as possible. You also have the high coordination effort for the professional researchers. You have the limited engagement and commitment due to the limited resilience of patient researchers. So in our project, we had very many and long times of absences, because just the people got in acute phases of their illness and had to stay at hospital or at home. Another challenge is to build this co-equal relationship between professional and patient researchers, which you need for the co-creation process. So you have to care for the appropriate frame conditions. You have to reflect on the different roles of the participants. You have to manage the expectations and so on. And if, as in our case, no face-to-face meetings are possible due to the risk of infection, it is very difficult to develop a team feeling or a feeling of cohesion. That was a challenge also in our project. And as I already mentioned, there's a challenge for the patient researchers to be not biased by being affected, or to find a balance between the use of own experiences and a suitable distance to one's personal perspective on the other hand. And finally, there are some benefits of the patient science approach. I clustered them here along the 3 dimensions of the citizen science evaluation framework by Kieslinger and colleagues. You might know that. So these are the 3 dimensions. With regard to the scientific dimension, the most important point is the inclusion and systematic use of an otherwise excluded expertise. This is the patient expertise. And due to that, we would say that the entire epistemic process, including the determination of the research question, becomes a different one, namely more holistic, we would argue, more robust, and with regard to the target group, also more in line with their needs and closer to the reality of their lives. Secondly, you have the participant dimension. There's firstly the empowerment effect. So you have patients and affected persons that are given a say and become the subject of research instead of the object of research. And you have the participant dimension. So on the participant dimension, also the learning effects regarding science in general and citizen science, but also regarding disease in focus. And on the socio-economic political dimension, you first of all get an especially high practical relevance and empirical realism of the results due to the included patient expertise. You get also new opportunities for exchange and encounters between patients and healthcare professionals, and also among patients themselves. And also these healthcare professionals experience a change of perspective by practicing such a co-equal attitude towards the patients, which most of them are normally not used to. And I now come to my last slide. In my view, the most important added value of the patient science approach is the systematic use of the patient's expertise in the research process. And only then you get the key benefits highlighted on this slide. And at the same time, this points also to a limit of the approach. So in my view, it makes little sense if the inclusion of the patient's expertise is not relevant to the epistemic interest at hand. So if it does not make an epistemic difference to include the patient's expertise, then you still get the benefits not highlighted on this slide, especially on the participant dimension. However, we would argue that these benefits are not sufficient to justify the additional effort you certainly need to successfully conduct such a patient science project. And yeah, that was my last slide. And thank you very much for your attention. I hope we have still some time to answer 1 or 2 questions.
Thank you, Nils. I will. There is a lot of interest and some questions for you. We will probably have time just for one. Okay. Someone is asking if you had to deal with ethical committees in setting up the project, since you are working with patients.
Yeah, I mean, the patients were recruited by our partner, the University Hospital Frankfurt. And just by default, every research is that is conducted in a university hospital that has to go through an ethics committee, and that's also what we did. But the interesting point is that we didn't do it at the very beginning of the project. I mean, we were in contact with them, but they said it makes more sense to wait until we have the research question and also until we have the questionnaire. And so we first developed all this and then applied for the ethics response, I call it.
Yeah. Yeah. Okay. Thank you very much, Nils. We will share with you the other questions. Thank you for your presentation.
Thank you.
And I would like now to move on to the next speakers, who is Kirsten Bevelander, who is senior researcher in public health and citizen science at Radboumdouk. I'm sure I will never be able to, as much as I practice, I will never be able to pronounce the name. So Chris, maybe you can say the name yourself. You're based in the Netherlands, and you will be talking about the value of citizen science in a study on chronic pain on the citizen science platform Claudians. Thank you, Chris.
Thank you.
Please go ahead with sharing your screen. Yeah, that's fantastic.
Yeah. Okay, thank you. So my name is Chris Beverander, and I work at the Radboud University and Medical Center in the Netherlands. I'm going to talk about the value of citizen science in a study on chronic pain. And we use the citizen science platform Crowdians for this. Let me see. So many researchers, they work on their own islands, and well, to date, of course, we swim more and more to other islands and collaborate with other researchers and share knowledge with each other. But still, there is an entire ocean of knowledge they leave untouched. And well, we need more ways to use the wisdom of the crowd. So many citizen science projects use citizens to fill in surveys or to collect and analyze data. And most of the research in healthcare is very expert driven. But lay people are also experts by experience, and especially when it comes to their own health. So this study explores how we can crowdsource knowledge, patient knowledge about their health, and in particular about chronic pain. So how do we crowdsource knowledge of patients? Often when citizens come to a healthcare professional, they are unaware of what is relevant information to share. People don't always dare to share information because it's very personal, or they are afraid to say something stupid or insignificant. And on the other hand, healthcare professionals may not always know what's the right question to ask, or if they are listening to information, to pick up very relevant information, which is important for future directions of research. So we used the Crowdians platform to crowdsource knowledge, and the way it works is pretty simple. Normally, experts or healthcare professionals are the ones who ask the questions, and now we ask the patients to come up with the questions, and they also answer to each other's questions. So the entire procedure is up to the patients themselves. So in the chronic pain study, we, for example, asked people how they deal with chronic pain and share that with us. So they go to the platform, go to the site, and if, for example, a patient uses a certain type of medication, the patient can then type in which kind of medication it uses, and it comes up as a question or a statement in the patient-generated survey. So they go to the site, they can already answer questions or statements of other patients. They can add their own ideas and experiences. And there's also always a moderator involved, just to be sure that people don't share very private things, and to avoid that, for example, questions or statements are there twice. Then the crowd can answer, and in this way a crowdsourced survey grows. And because people also answer to each other's question, you can determine certain value of the suggestions. So for us, we wanted to see whether this is a useful and valid method to gain insights. And we did this study once before, and we were crowdsourcing childhood predictors of adult obesity, and we generated well-documented predictors of adult obesity, and we were able to prioritize also predictors of adult obesity. So for example, whether people used to have a garden at home, or whether there was a school garden, or whether they cooked with their parents, or that there was food education at home. For this study, we used a different design. So a very traditional method to gain new insights and for theory building is conducting focus group sessions. And we compared the focus group sessions with the crowdsourcing methods. So we compared the insights of those two methods to each other. And we worked with specialists in chronic pain. And they already thought with patients about the topics we wanted to gather information on. So how do you deal with chronic pain? What do health professionals have to ask you to gain better insight in your situation? And what facilities would be needed if there was a care center for chronic pain patients? So these topics were discussed in the focus group sessions. And in the Crowdians platform, these were 3 different and separate surveys. People could generate a survey and answer questions to. So if we look at the results and if we compare then the focus group with the crowdsourcing method, we generated pretty similar themes, but the crowdsourced method sometimes provided a bit more detail. So for example, about personal relationships, mental state and emotions, and the impact of chronic pain on life. If you look at medication, we were able to get more detailed information about what kind of medication they took. For example, cannabis oil, or what kind of therapies they followed. If you look at the second question, so what would health professionals have to ask you to get better insight in your situation? We also generated similar teams, but again, the crowdsourcing procedure provided more detailed information. So patients really wanted their healthcare professional to work multidisciplinary, so in more together with other experts, and share information, and also really look beyond their own expertise. So it's very important for patients that people ask them how their situation affects their daily life and work, and also if they need help with financial matters and insurance problems, because most people, they can't go to work or they have an unemployment benefit. They really appreciate it when people take time for them. And a really important question was the acceptance of chronic pain, because if people accept chronic pain, they are more ready to deal with it. If they don't accept their chronic pain yet, they are really in search for things that cause chronic pain. And for healthcare professionals, that's really important to know. So if there were a care house, we also generated similar findings between the focus groups and the crowdsourcing method. And it related to topics as the facilities, type of therapy, kind of contact, team, and help and assistance. So to conclude, crowdsourcing can generate similar topics as in focus group sessions, which is really a good thing to know. The crowdsourcing seemed to sometimes generate more personal and private topics. So people asked each other questions and they answered to these questions about suicide, depressive feelings, sex, and drug use. And we think that's because the crowdsourcing method was more anonymous, and people really could take time to think of questions and participate in the research. So crowdsourcing can be used as an easy and low cost and efficient method to gain insight in healthcare improvement. Then one last note about the platform. We improved the platform by working together with people with mild intellectual disabilities to make it accessible for everyone. And we plan to make also an English version of the platform, so more people can use it. So thanks for your attention.
Thank you very much, Chris. We have a few questions from the participants, and the first question is from someone who would be interested in joining the Crowdians platform, and this person is asking if anybody can join or if you need to be contacted first through a medical professional or something.
Well, so we worked with a prototype, and now we received funding to further develop the platform. So for now, it's still in Dutch, and then the next phase, we're going to translate it. And if there are researchers who want to work with it and also can apply for funding, because so the platform is part of a foundation. So we want to make it part of a scientific community, so people can invest in the platform, and then we can build it together and then let it grow, so that more people and researchers can also do citizen science. So yes, it is possible to use it, but then send me an email and we will just see how we can make it possible. Yeah.
Thank you. And then also one more question. So I will read it for you. Did you ever get someone on the platform who invented stories, for example, of illnesses they did not really have? And the person is also saying, I do not suggest that someone who does this does not need help, sorry. They generally do need help and attention. What does the moderator do if someone is in danger?
So if someone makes up a story, then we don't know. But if, for example, he suggests something or makes a question or statement, and it's not supported because all the patients, they answer to the statements and the questions that are generated. So then you as a researcher would know that that kind of suggestion wasn't that important for your research, because other people didn't react on it because they didn't feel like it that way or whatever. If the person really needs help, the platform is really anonymous, so we cannot provide help. But what we did, especially when we saw that people were talking also about suicide and depressive feelings, is that in the communications around the research and also on social media, we had extra attention for people who were feeling depressed, and then assistance or help numbers they could go to or phone to, for example. Yeah.
Thank you very much, Chris. There are no further questions, so I would like to thank you very much for your presentation. And of course, if anyone else would like to know more, they can get directly in touch with you.
Yeah, thank you.